The purpose of this video is to show a more detailed close-up view of the unblocking process for a male cat. The first part of the unblocking procedure is typically the most difficult. So, in order to retract the prepuce and extrude the actual penis so that you can visualize the urethra, I take my non-dominant hand, which is my left hand, as in this picture here. The cat will be in dorsal recumbency, fully anesthetized or heavily sedated. I will take my thumb and my forefinger and I will very gently grasp the tissue around the penis itself, which is the prepuce, and then push that tissue cranially and also dorsally towards the patient's back. Whenever the penis is extruded, it should look like this, right? So I've got my thumb and my forefinger extruding the penis by forcing that preputial tissue cranial and dorsal towards the patient's tail or back. So this will allow me to visualize the urethra. And as you can see, the urethra is very small in a male cat. This is why they are predisposed to getting urinary obstructions. So we've got a video here. And you can see that we're attempting to extrude the penis, but it's very difficult. So if you just move this prepuce cranially and dorsally, that will help you extrude the penis. So we're attempting to extrude here. Once we're able to visualize the penis, then we're going to attempt to insert the catheter into the penis, into the urethral opening. We're going to struggle a little bit here, which is pretty common. You can see that we're just trying to gently twist, use a lot of lubricant to make sure that you don't traumatize the urethra. Once the doctor is able to get just very minimally inserted into the urethra, at that point, I move the patient into lateral recumbency. I have the doctor grasp the prepuce and pull it caudal. The point of pulling the prepuce caudally is to extend the urethra and straighten it out. I have had numerous instances where I've been unable to catheterize a cat, but as soon as I move them into lateral recumbency and I grasp that prepuce and pull it caudally, I'm able to advance the catheter fully into the bladder at that point. So that's what we did here. We're just checking confirmation here by placing the syringe. We're obtaining urine, as you can see. So we're pretty happy about our placement here. Once you have the urinary catheter in place, then you're going to secure it. So we're going to move the cat back into dorsal recumbency. And while we wait on getting our suture material, we're going to just take a look at things. We're going to get our suture ready. Usually I use 3-0 ethylon. It's a small, non-absorbable suture. So we're going to zoom back in here so you can see that there's urine coming out of this slippery Sam catheter. We're grabbing our instruments in order to place this suture. You can use needle drivers if you want. You can also cut off the needle off the suture and just use a straight needle, like a 22 gauge. 1-inch needle would be fine in this case, but this doctor wanted to use the actual needle drivers. Here's a close-up view of us placing the suture. So on this slippery Sam catheter, there are 4 different large holes where you can place your suture. So she's going to place the suture and she's just going to do a simple hand tie on each one of these 4 areas to make sure that this catheter is in place. So here you can see that we've got 2 of the sutures in place, and then we go ahead and hook this up to a closed collection set. After the closed collection set is in place, then we're going to place our other final two stay sutures for a total of 4 sutures to keep this catheter intact. Once I have the catheter completely sutured in place, I usually tape it to the patient's tail gently as well, just so there's a little bit extra security. If this catheter gets caught on something, I don't want it to come out. I want it to be secured in multiple places.